Hello everyone. Today we are going to learn about care of patients with pacemakers. As this is a huge topic, I am going to divide it into part 1 and part 2. You can also check the previous topic, that is cystoscopy diagnostic procedure. I will give the link in the description. Please like, share and subscribe if you like these videos. In this video, I am going to cover introduction, types and pre-procedure requisites of pacemakers. In the upcoming video, I'll cover the procedure and a nurse's role, so please stay tuned. So what do you mean by a pacemaker? A pacemaker is a small piece of equipment that helps your heart to maintain a regular rhythm. In other ways, pacemaker is a small device used to treat some arrhythmias. Arrhythmias means irregular heartbeat. This is the image of the patient with pacemaker. Please look after it. Now let's move on to the types of pacemakers. As you all know, pacemaker is a small device used to treat some arrhythmias. So there are three types of pacemakers: single chamber pacemaker, dual chamber pacemaker and biventricular pacemaker. Now let's move on to the single chamber pacemaker. As you all know, the heart has four chambers: right ventricle, right atrium, left ventricle and left atrium. Now see through that arrow which is marked there. Single chamber pacemaker means that uses a single wire attached to one chamber of heart. Next is dual chamber pacemaker. Now see through that two arrows which is marked there. Whereas in single chamber there is only one wire attached to one chamber. In this it uses two wires attached to two chambers of the heart. Next is biventricular pacemaker. In this, it is used in cardiac resynchronization therapy. What do you mean by cardiac resynchronization therapy? It is a procedure to implant a device in the chest to make the heart chambers contract in a more organized and efficient way. Now some might think dual and biventricular pacemaker looks similar. What's the difference between that? Now just see the arrow marks which is marked in this biventricular. In dual, it is two wires to the two chambers, whereas biventricular is also connected to the two chambers of the heart. But the difference is, dual is connected to the right atrium and right ventricle, whereas biventricular is connected to the right and left ventricles. I hope you all understood the difference. If any confusion is there, please look through the photos of each types. Now let's move on to the pre-procedure requisites. Requisites means for which and all condition this procedure is necessary to do. There are four conditions. First is heart disease, second is heart arrhythmia, third is congenital defects, fourth one is long QT syndrome. Now one by one let's move on to the conditions. First is heart disease. This is a disease condition that causes a narrowing of the arteries which lead to the heart. Heart disease is also known as cardiovascular disease. This is the image of the heart disease. When a patient has suffered from heart disease for an extended period of time, they will often sustain damage to their heart muscles, such as obstruction or any other condition. The same damage can also happen due to age, and in both cases can make it difficult for your heart to maintain its own steady beat. Patients with heart diseases are sometimes given pacemakers to minimize their risk of a heart attack. The most common heart disease is coronary artery disease, which might lead to heart attack, so pacemakers are given to minimize their risk of heart attack. Now let's move on to the second condition, that is heart arrhythmia. As I said already, arrhythmia means irregular heartbeats. Just go through these 5 symptoms of cardiac arrhythmia: palpitations, heart pounding, panting, chest pain, dizziness and fainting. In some cases, the heart will be too fast. It is also known as tachycardia. In other cases, it's too slow. It's also called as bradycardia. And often, it just beats irregularly. That is also known as arrhythmia. These symptoms may originate from heart disease, but in many cases, patients are born with arrhythmia, that is irregular heartbeats. Pacemaker implantation surgery is an excellent tool for patients who are suffering from irregular heartbeat. It can give a sense of confidence knowing that if the heart rate continues to beat irregularly, there is a mechanical solution. Now let's move on to the congenital heart defects. What do you mean by congenital? Congenital means it is there from birth. all the birth diseases are called as congenital. So, when the body has to struggle to pump blood through clogged arteries, it weakens the heart muscle and leads to heart disease. Let's see this image. Some of the most common CHD are leaky valves and holes in the heart. With the marvel of modern medicine, these issues can often be detected right after birth. For patients whose congenital issues are not available to be repaired at the younger age, pacemaker implantation surgery may be required as they get older. Now let's move on to the long QT syndrome. What do you mean by long QT syndrome? See to this graph. The heart's electrical activity marked on the electrocardiogram, that is also called as ECG. This is the image of that. Normal QT interval is shorter gap and long QT interval as a longer gap. That is the difference between normal and long QT syndrome. Long QT syndrome can cause irregular fast heartbeats in patients. This rapid change in pulse can trigger fainting, seizures, and even death. Often this condition is congenital. It occurs by birth, but it can also be caused by medications or other conditions. The best way to control long QT syndrome is through pacemaker implantation surgery. Thank you everyone for sparing your precious time with me. Stay tuned for the part 2 and I hope you all understood. Thank you.